Hello, everyone. Welcome to another edition of Medicare Monday. I'm your host, Joseph Katz, here again with CoverRight CEO Richard Chan. Richard, what is going on today?
Hi, Joseph. Just the usual in the Medicare world, helping people enroll in and find the best plan.
So, there's been some news about Medicaid redetermination. So, I want to talk about that and how it impacts people who are on Medicare or maybe doesn't impact them. So, let's start with that. What is Medicaid? And then we can go into the whole redetermination topic.
Yeah, so Medicaid is a joint federal and state program, really for people with limited income and resources to help them with health costs. It's not exclusive to people on Medicare. People under 65 can also be eligible for Medicaid. And the rules around qualification differ by state. So it's up to your local state regulations on what the limits and what the eligibility is.
So Medicaid is a state program, Medicare is a federal program. How do they work together?
Yeah, so when someone has Medicaid and Medicare, it's possible for the two programs to coordinate benefits. So someone who is eligible for both is typically called a dual eligible beneficiary. And what that just means is if they are on original Medicare, Medicaid will typically work to supplement some of their costs. They can help pay for premiums, co-pays, co-insurances. If they're looking at private plans, there are special plans called Medicare Advantage plans with a DSNP designation, which means dual special needs plans, specifically for people on Medicare and Medicaid. And what those plans do, they just coordinate benefits into one plan.
So there's been news about Medicaid redetermination. What's all this news? What is redetermination and what's going to happen? It's a lot of questions.
It's a good question. So Medicare redetermination is really the process of reviewing someone's eligibility for Medicaid. Typically, that's an annual process. You don't get an automatic rollover for Medicaid. The news recently is that those redeterminations with the COVID pandemic were put on hold and for about 3 years, and the redetermination process has just started again for some as early as February 1 of this year. The redeterminations have started. So what that means is people can expect to receive information on whether they're still eligible. The estimate right now is about 15 million individuals might be at risk of losing Medicaid coverage. And so those individuals will find out over the near future about the results of the redetermination.
So you mentioned earlier dual enrollment. So if I'm on Medicaid and I have a dual enrollment and I lose my Medicaid, I'm going to lose my plan. It's if I'm understanding correctly. So what do I need? What does someone need to do who may be losing their Medicaid in this redetermination?
Yeah. There's a few things. If you're on original Medicare and you have Medicaid, you don't proactively need to do anything. If you lose Medicaid, you will just be on original Medicare. The question for you will be, do you want to consider maybe going to a Medicare Advantage plan at some point? For people who are on a private Medicare Advantage plan, who in particular, anyone on a dual SNP plan, the special plans for people who are both eligible for Medicare and Medicaid, you will lose eligibility for that plan. So typically you do have 60 days from the end of your Medicaid coverage or your redetermination to transition into a regular Medicare Advantage plan. So that's what you need to do. If you're on a regular Medicare Advantage plan already, you may decide to stay. You will just lose some of the benefits of having support from your Medicaid program, pay for co-pays and things like that.
If I am on a Medicare Advantage plan and I decide I no longer want an Advantage plan, I can go back to original Medicare during this time period?
Yeah, you do have a special enrollment period to change your plan if you have a change in Medicaid determination.
Okay, so basically, based on where you live, the redetermination dates may have started or may be coming up quickly. If you are on a dual Medicare, Medicaid program and you lose your Medicaid, you have to figure out if you're staying on original Medicare, if that's what you have. If you're on Advantage, you're going to need to reapply to another plan. and or consider original Medicare. And you have roughly 60 days to do that. Did I
that's right.
catch the main points there?
Yeah, you did. That's great. Yeah. So, I mean, if people are unsure, the best thing to do is just to reach out. We can help determine whether you need to do anything about your Medicare.
Right. And people can reach Richard or the team here at CoverRight at hello@coverright.com or visit coverright.com and fill out one of our forms. We're happy to help anyone get through this process if they're being impacted. Thank you, Richard. Until next week, have a great day.
Thanks, Joseph.